Getting an endoscopy soon? Don't worry, this quick guide will walk you through everything you need to do before the procedure. Step 1. Confirm instructions. First, confirm your doctor's written instructions. Each clinic may have different rules, so always follow their directions first. Part 2. Talk about medications. Tell your doctor about any concerns about all medications, especially blood thinners, aspirin. Some blood thinners need to be stopped a few days. Before your procedure if it is therapeutic, while on the morning of the procedure if it is diagnostic. Diabetes medications, you may need to adjust or pause them before your test. Simply follow your diabetic nurse instructions. Step 3. Know when to stop eating and drinking. All patients stop solid food 8 hours before the endoscopy and OGD. You can usually drink clear liquids, like water, broth, or apple juice, until 2 hours before, but double check with your doctor. Step 4. Hydrate wisely. Drink plenty of clear fluids the day before. Staying hydrated helps with the IV and makes recovery easy. Step 5. Dress comfortably. On the day of the procedure, wear loose, comfortable clothes. Avoid jewelry, makeup, or anything around the mouth or eyes. You can keep your jewelry on if you want. Step 6. Pack essentials. Bring your ID, insurance card, list of medications, and a responsible adult to take you home. You won't be allowed to drive after sedation. Step 7. Plan for rest afterward. Plan to rest 24 hours after the procedure. If you had sedation and no food after 1 hour. If you had throat spray, light meals and relaxation are key. Skip anything stressful or strenuous. Remember that if you are booked for colonoscopy, you need to fast for 24 hours, and no needs no nuts, and hydration is very important. Bar tips remove nail polish so they can monitor your oxygen. Take out any dentures or retainers at the clinic, and if you're unsure about anything, don't hesitate to call your nurse or doctor. Nurses are there to support you all the way and hold your hands.